You ever had that patient who just nods and smiles and says, yeah, I'll book my next visit, and then simply vanish like a ghost? You assume it's about money, that they can't afford it, or they weren't ready yet. But the truth is this: they didn't believe you could change their life. Now, I know that's a bit harsh, but let me explain. Because this isn't about technique. It's about trust, timing, and translation. In the next few minutes, I'm going to show you exactly the micro moments that decide when a patient stays for 10 visits, or 20, or 50, or a lifetime, or simply just disappear after one, and how to fix it today. So let's go. Hi, I'm Dr. Laurence Tham, chiropractor turned business strategist. And for over 2 decades, I've helped hundreds of chiropractors build what I call freedom practices. Practices that scale profit and purpose. Every week, I drop real strategies that grow your income, your impact, and your time freedom. Let's talk about the one thing that no one teaches you in chiropractic college or in business or in practice: why patients actually commit to care. Rebooking doesn't happen at the front desk. The action does, but it actually starts way before that. It happens a few minutes earlier, when the patient decides internally as they walk towards the front desk. They are thinking, this person gets me, or this person is like every other chiropractor I've ever tried. That moment is either won or lost by certainty. They're not buying care plans. They're buying your conviction. When you are crystal clear about what's wrong, what's next, and why it matters, they borrow your certainty until they have their own. Most chiropractors try to convince. The best ones simply just transfer their belief. So let's get really clinical about this. What are the 3 reasons why patients don't rebook? Number 1, you spoke Chinese to them. Unless they understand Chinese, they're not going to understand it. You explain subluxation, L5, biomechanics, but they speak results. Translate every finding into their language. This is why you can't sleep. This is why your hand keeps going numb. Or this is why you're getting pins and needles down your leg. Information doesn't inspire. Translation does. Trust me, I've seen so many chiropractors try to fire hose and pour more and more information, but that doesn't help people. Reason number 2, you solve the wrong problem. Most patients come in because of certain type of pain. They're looking for pain relief, but you sold them wellness right off the bat. You need to first start with what they want and what they came in with, and then lead them to what they actually need. That's ethical persuasion. The challenge is that you have to learn to translate that. It's not just ignoring the problem or the pain. It's about how do you start with where they're at and slowly get them to understand why they have the pain in the first place. Reason number 3, you left the story unfinished. You told them what's wrong and what it cost, but not who they could become. Humans buy identity upgrades, not just adjustments. Paint the version of them on the other side of care, and how much better they're going to be, who they're going to be, and what they can do. Sell them the value, not just the benefits. So here's what I call the 3-step Rebook Framework. You can use this literally tomorrow. Step 1, mirror before your mentor. Repeat their exact words back to them. One of the best things you can do is repeat their exact words back to them before giving your advice. So you're frustrated, you can't pick up your daughter without pain, right? That line alone raises the rebooking rates instantly because they felt seen. You have to have a human-to-human communication. They want to know that you listen to them. They want to know that you feel what they're going through. This person is choosing certain words and certain emotions and sharing it with you. And it's your job to be able to mirror some of it back. I'm not suggesting you repeat everything back to them. I'm suggesting you start with some of the communication and those words in the tone, in the manner that they showed up. Step number 2, what I call map the bridge. This is about showing a simple visual. Here's where you're at, and here's where we're going to go, and here's when you'll feel it. Certainty lives in the clarity, but bridging the gaps between each of these points. They need to know they're starting from somewhere, going through a process from pain to a promise, your certainty in the process and understanding their pain, knowing that you can promise something they actually want, and the certainty of the process of getting there is what's going to help you rebook more patients. Step number 3, confirm the future. Every report of findings with a future-paced phrase, such as, When your headaches are gone and you're training again, you're helping their brain rehearse success and embodying that future. That's neuroscience, not sales. This is when the shift happens. Stop trying to impress. Start trying to be understood. Patients don't rebook because they lack commitment. They rebook because they feel connection between you and them. They want to feel heard. They want to trust you. The best communicators are louder. They're just clearer. And clarity converts every single time. So next time a patient ghosts you, don't ask, what's wrong with them? You need to ask yourself, where did I lose their trust? You self-responsibility to figure out, where did I go wrong? Because if you don't have that self-awareness, you're not going to be able to change the way you do things, and then you're always going to blame the patients. But you do not take any responsibility in yourself to change anything that you could have done to improve the situation. This one question will rebuild your entire practice. If you want to master how to communicate, retain, and lead without pressure, this is exactly what my Beyond 7 coaching group does. Links are below. Align first, amplify next. So let's get out there. Let's connect with our patients. Make them trust you, believe you, that you're an authority and that you know what you're talking about. Also, take a look every single day, showing up to work to make sure you believe in what you offer. You believe in your services, that you can change people's lives. The reality is that you have to create value for them. If they do not believe that you can create that value, they're going to leave. They have to trust you and believe that you're the authority that can help them with their problem. Why would anyone stay with someone like yourself who didn't believe in what they offer? If you do not believe in what you offer in your services, then you need to rethink this and go, how do I gain more belief in my system? Do I need to read more? Do I need to do more research? Do I need to have better technique? Do I need to practice more? If you can't figure that out, this is never going to work. No matter how many scripts I give you, you have to believe in what you offer. You have to fundamentally believe that you can change people's lives every single day. So go out there and change some lives, change your practice, and more importantly, let's go change the world. I'll see you on the next video. And if you've been getting a lot of great value from these videos, please go check out my other ones and make sure you share these videos with someone else. Give me a like and share this video to help your fellow practitioners to be better practitioners and help them have the freedom you desire.